How do plastic surgeons handle bleeding emergencies? When it comes to managing bleeding emergencies, plastic surgeons follow a structured approach that prioritizes patient safety and adheres to established emergency protocols. The first step is to assess and stabilize the patient's airway, breathing, and circulation. This is in line with the principles of advanced trauma life support. Controlling any external bleeding is crucial. Surgeons typically apply direct pressure or use tourniquets if the bleeding is severe, aiming to stop it quickly. In the operating room, controlling bleeding involves meticulous surgical techniques. Surgeons may perform wound debridement under tourniquet control, which allows for a clear view of blood vessels and other critical structures. This visibility helps them identify and ligate, or tie off, any bleeding vessels. They may also use vasoconstrictive agents like epinephrine in tumescent solutions during procedures. These agents help minimize bleeding by constricting blood vessels in the area being treated. Managing anticoagulant medications is another important aspect. Surgeons carefully monitor these medications before and after surgery to reduce the risk of bleeding. If postoperative bleeding occurs, plastic surgeons are vigilant for signs such as persistent or increasing bleeding, swelling, pain, dizziness, or a rapid pulse. They instruct patients to seek immediate care if they experience heavy or uncontrollable bleeding. In emergencies, plastic surgeons may provide urgent care in their clinic or direct patients to the emergency room. There, further evaluation can take place, including laboratory tests and imaging, such as ultrasound or computed tomography angiography, to assess the extent of the hemorrhage. For patients who are in stable, hemodynamic resuscitation becomes a priority. This includes fluid replacement and blood transfusions if necessary. Postoperative protocols are also critical. Surgeons emphasize careful wound care, the use of compression dressings, and drains to prevent fluid accumulation. They often recommend activity restrictions to minimize the risk of bleeding. Additionally, they advise patients on medication management, particularly regarding blood thinners, which should only be taken if specifically directed. In summary, plastic surgeons handle bleeding emergencies through a comprehensive approach that includes rapid assessment and stabilization of vital functions, immediate control of external bleeding, surgical exploration, and precise hemostasis under controlled conditions. They use vasoconstrictors and manage medications carefully to reduce bleeding. Continuous monitoring and prompt intervention for postoperative hemorrhage are essential, along with coordinated care involving emergency services when necessary. Patient education on recognizing signs of bleeding and understanding postoperative care is vital to prevent complications. This thorough approach aligns with patient safety protocols and ethical standards in plastic surgery, aiming to minimize morbidity and mortality related to bleeding complications.